They called it the Minnesota Starvation Experiment. They found 36 volunteers who didn't want to kill people. It was against their religious or personal beliefs, but they wanted to help with the effort. They wanted to help people. They volunteered to be starved under a football stadium at the University of Minnesota in the US for a year. They were fed a baseline. These are healthy 21-year-olds. They were given 3,000 calories, which is a normal baseline even to this day by the RDA, for 3 months to stabilize them. They then were starved with 1,800 calories and about 0.7 grams per kilo. Actually, you'll realize this is twice what we feed the ICU patient for 2 weeks. This starves normal people. Imagine what it does when you give half this to an ICU patient. And then they were supposed to lose 1 kilogram a week, which they did. It was dramatic. Everyone lost weight. The malnutrition was unbelievable. Unbelievable. All the men lost interest in sex, so it had to be bad. It had to be bad. They were depressed, they were anxious, they were delirious. Sounds a lot like our ICU patients. You wonder, we say delirium's caused by drugs and lack of sleep and all those other things, but the starvation we put upon our patients in the ICU and in the hospital, we know that causes delirium in normal people. Imagine what that does to sick people. It's an unexplained, unknown cause with very little data. So they lost a lot of weight. 70 kilos down to 52 kilos within that few-month period. It's about the amount of weight most ICU patients actually lose, as I watched them over the years. And then the idea was, let's give them back different levels of calories to see what it takes to regain weight. It was much harder than they expected. They started with 400 to 1,200 additional calories per day, up to 3,400 calories a day, and no one gained weight. In fact, most of the men continued to lose weight, and these were not hypermetabolic or catabolic ICU patients. These were normal people. So then they went up more, up to 4,200 calories a day. And they discovered it took an average of 4,000 calories to regain weight after you'd suffered a weight loss like this. 2,000 didn't treat anybody. Didn't treat anybody. No one recovered on that. 12 men stayed for 2 months longer being monitored, eating whatever they wanted. They ate 5,000 to 12,000 calories to recover on their own. It took 6 months to 2 years for these men to recover from this few months of starvation. And somehow our ICU patients are supposed to leave the ICU and go back to their own lives and recover on their own? How is that possible without our help? It's led to the perhaps most important nutrition study ever done. If you haven't read it, you should, although it's 1,500 pages long, so it might take you a moment. But it teaches us more than most studies, and it will never be repeated. So what does this teach us that we can take away? Well, it's interesting. When we actually study the total energy expenditure of a recovering ICU patient, you can see these are week 2 numbers I have circled. It is almost exactly the same as those starving Minnesota men 70 years ago. 3,000 to 4,000 calories is the total energy requirement of a patient in recovery from ICU, and this is measured, and these are ICU patients now. It's amazing. We haven't changed much as humans in 70 years. So we need significantly more calories in our recovery phase.